This video is all about medical weight loss. So sometimes I have patients coming in saying, well, I don't want to do this. What else can you offer me? Or I don't want to do this. So I'm going to go over everything that I know that we can offer to a patient for weight loss. And then, or I guess everything that's available, I may not personally offer it. So as a naturopathic physician, I'm going to start with the natural things we would want to address first. So if I have a patient coming in for weight loss, or it may have been you that came in and I referred you to this video, the first thing we're going to want to do is, look at all the body systems. So in the world of endocrine, every gland affects every gland. So I look at pituitary health, which kind of ties in with the hypothalamic health, thyroid health, adrenal health, the ovarian health. So I'm looking at the whole endocrine system, and there is testing for that. So once I know if the patient does not have an adrenal condition, a thyroid condition, a pituitary condition, and I'm not even talking about other medical conditions in the body yet. When patients come in, I do a full physical and we do our regular lab work, but I'm specifically talking about weight loss. And the endocrine system really plays a large part in our weight. And then we'll go on to, if it is a problem endocrine-wise, then we'll go on that, and hopefully I'll have another video here soon so it'll address the separate topics of thyroid health, adrenal health, and so on. And then we want to look at the person's sleep habits. Do they have sleep apnea? Are they getting a full amount of sleep? Because as we know, that would determine, are they putting off growth hormone and melatonin at night, which definitely can affect weight. We know they've done a study about night shift workers tend to have higher rates of obesity and shorter lifespans, maybe even risk of more cancer. And then kind of looking at the whole nutritional part of that, the brain chemicals and neurotransmitters, things like our serotonin, tyrosine, tryptophan. Now there is specific neurotransmitter testing for that, but there are simpler things we can do first. So I may put patients on a specific diet for them, because not everyone does well on paleo and not everyone does well on high carb. There's actually a test we offer. It's a DNA test called Pathway Fit. The company is called Pathway Genomics, so you can look that website up and check it out. But basically, we swab the inside of the cheek, we send it off to them, and it tells, based on your genetics, here's what you need to do to lose weight. Here's the food you should eat to lose weight. Here's the exercise you should be doing. I think that's phenomenal, and I really think that's where medicine's going with that. So we do offer that DNA test as well. And then we can kind of help, instead of me guessing what diet is good for them. I know there's some great books out there like the blood type diet and things like that, which can kind of help a patient focus on it, or we're just doing food elimination, like, well, we think you have a dairy issue. Let's avoid dairy for a couple weeks, see how you do. So yeah, we can still do all those. I may put them on a sugar challenge diet. We'll go over all that in the office. Maybe the anti-inflammatory diet or a gluten-free diet. So again, a diet specific for that person, and then we go over the specifics in the office. And then what exercise is best for them. If they don't do the DNA test, then usually I start with really light exercise. Like everyone should be walking a half an hour a day, rain or shine, every day. It should just be a habit to live a long, healthy life. I really like stretching. There's some great yin yoga videos on YouTube. If you're kind of scared of yoga and you want to ease into it, just start with yin yoga, because it's mostly floor stretching, and I find less intimidating instead of going to a class and not being able to do any of the poses. There is the whole movement of the short burst intense exercise where, you go really hard for 30 to 60 seconds, and then you go to just like a walking pace for 60 to 90 seconds, and you keep doing that as an interval for 15 or 20 minutes. I mean, that's great for some people, but not everybody, because our genetics are all different. We may go on an herbal support diet where, I use various herbs depending on the patient and what their body's needing based on the testing we did prior. And then, I do think it's a really great idea to do a trial of avoiding meat, go on more of a vegan, plant-based diet, or even at least a vegetarian diet or initially maybe just to ease into it, avoiding your red meats and chicken, and you could just be doing fish and shellfish, and then eventually weaning off that. We know going to a plant-based diet leads to less inflammation, less cortisol, less anxiety. And then the side effect is weight loss. It's kind of great. I may have the patient avoid caffeine, again, to lower cortisol levels. But again, when we're doing the adrenal testing and I have the questionnaire on adrenal health, then, we'll specifically address that. And then, avoiding your toxins like pesticides and plastics. If you're still using Roundup at home, be really careful because, those pesticides, your body has to store your toxins somewhere, and it tends to store it in fat. So if I have a patient that's exposed, like say they work in a salon and they're exposed to a lot of toxic chemicals and dyes and products and hairsprays and all day long every day, maybe they have a hard time losing weight because all that's being stored in their fat and their body's resistant to lose that because that's where it's storing it. It's a theory. Okay. So, we may look into hormonal options for patients. So HCG, which is human chorionic gonadotropin, I tend to prescribe the prescription strength. I don't dispense it out of my office. I have my patients go to the pharmacy. That way they can ask the pharmacist, how did they compound it? Where did it come from? Those are good questions to ask, by the way. I have patients that say they bought HCG off the internet from China, and that just scares me. I don't know what's in that. They don't know what's in that. So that is one option. Why I think HCG works, we use it off-label. It is FDA approved as a fertility treatment. So yes, it's stimulating the ovaries and the woman's body to produce more progesterone. And if you're estrogen dominant, you're going to tend to put more fat on, and progesterone, balancing that out, tends to help you lose weight. So really, I'm using it with women for hormonal balance. I do tell them it may make them more fertile. I'm not a fertility doctor, but may make them more fertile. And the side effect may be weight loss. So, and I let them know it's not FDA approved for weight loss. It's off label for that, but we're really using it for, healthy hormones and possibly fertility. Okay. Now the world of prescriptions, a lot of these I may or may not prescribe. I'm a naturopathic physician. I tend to go towards things that are more natural, but every now and then I'll have someone that wants to try a medication. The good news is, I monitor them closely and we do the smallest amount possible. But the biggest one patients ask for is phentermine. So what is phentermine? Well, it is a stimulant. It's been out for a long, long time. I have some notes here, but I want you to know, do not consider phentermine if you have uncontrolled hypertension, glaucoma, a history of drug or alcohol abuse or addiction, vascular heart disease, for example, a patient with angina or have had a heart attack in the past, mental or mood problems such as severe anxiety, bipolar depression, other psychoses, or even schizophrenia, a hyperthyroid state such as Graves' disease, or even Hashimoto sometimes can be mixed. They can have their highs and lows with that. A history of stroke if you're currently nursing or pregnant. Okay, if any of that's going on, you're not going to want phentermine, or no one hopefully will be prescribing it, and hopefully they're going over that history. And of course, the main side effects with phentermine is dizziness, drowsiness, with some people, blurry vision, but more than that, it can cause hallucinations, seeing things. You're not supposed to drive right after taking it. So it's a pretty potent med, but it's an appetite suppressant. So it's putting your body in that fight or flight mode. Well, when you're in fight or flight mode, digestion slows down because all your body's energy needs to go to like the sympathetic response, right? So the pupils have to open so you can run from the tiger and see where you're going. And, dry mouth, slowing down digestion, heart rate going up. And so it's that fight or flight feeling constantly. So yeah, it's revving your heart rate, revving the metabolism. Okay. Other products we'll talk about that are on the market for other things. So a lot of patients are overweight, maybe due to addictive behaviors. So Wellbutrin is actually an antidepressant that may treat addiction. So some weight loss doctors are using that for their obese patients that are a little bit depressed and have some OCD addictive behaviors. Naltrexone is also used in these diet pill formulas by prescription for treating the addiction component. And I'll talk about that now. So there is a medication on the market now called Contrave, and that is a mix of the generic form of Wellbutrin, which is bupropion, and naltrexone. There is a black box warning on that medication because you put those two drugs together, there's a lot of side effects. So, but that's where those two come in. Other medications, well, let's go over the over-the-counter ones. Orlistat is over-the-counter. It's a lipase inhibitor. So those are the ones where you want to make sure that you might be wearing some protection in your underwear. Some people actually have little releases of stool when they're on things like that because the fat just does not absorb. It just goes right through you. And then there's other brand names like Li or Xenical. It works in the same way, okay? Then there's Belviq. The generic name for that is lorcaserin, and that increases serotonin levels in the brain, which may, obviously treat the patient that may have compulsory or like depression symptoms. And then there's Qsymia, which is a mix of phentermine and topiramate. Again, we talked about phentermine. And topiramate actually is an anti-migraine, anti-seizure drug, but it also reduces appetite. So that's a blend as well. And then there's liraglutide, which works to increase insulin levels, which could lead to weight loss. Again, this is not something I know commonly used for weight loss. And it also, the big side effects may cause thyroid tumors. So that should be used with great caution. So those are all like the medical things that I know of for weight loss. Now, of course, we haven't even gotten into the subject of nutrition and exercise, but I really like kind of going back to square one, looking at the whole health of the patient. And I believe in mind-body medicine. Our past traumas and anxieties and fears really play a part with who we are and where we are today. If the person is just working 15 hours a day, not getting any joy, overworked, everything really has to be addressed with weight loss. But I thought that was some good information to share initially. And thanks for watching.